putting the country on alert level 4 due to what he terms a massive resurgence of infections in the country, and many ways that we've been told in terms of how to deal with COVID-19 and the protocols of washing your hands, sanitizing and social distancing. But to give us more on how to protect ourselves in this time of fighting the pandemic, we're joined by Dr. Mabowa Makhomisane. You are the president of the Independent Practitioners Association, the Limpopo branch, but we're speaking to you as a general practitioner today. Thank you so much for making the time, just in terms of helping us to dispel the myths and give advice in terms of home remedies regarding COVID-19. And this is an important conversation coming from a general practitioner who's supposed to be scientific. But what do you want to say to the nation?
Thank you, and good morning, Desiree, and good morning to your listeners as well. Now, I think this is a very important topic, especially now that we are now in the third wave. What is really happening now is that we're seeing a lot more infections, and a lot of people are actually being treated at home. As you would know, about 80 to 85% of people that contract COVID-19 usually have mild to moderate symptoms, and these patients are generally treated at home. So one of the most important things to remember when you are at home and you're being treated for COVID-19 is that resting is one of the most important things, because this gives your body a fighting chance in terms of recovery. Now, when you're resting at home, it is also equally important for you to continue your normal daily movements as you would even when you do not have COVID-19. And the main reason for this is simply because when you sit in one place for a long time, it can lead to other complications such as blood clots and DVT. So moving around while you're at home, but at the same time not engaging in strenuous activities and allowing your body to rest makes a huge difference during that period of quarantine of 10 days. But one of the most other important things one need to remember is the issue of nutrition. And this is the issue with pretty much all viral infections. When you have an infection, it is very important that you continue eating food, nutritious food as much as possible. But generally, when you're sick, you don't feel like eating. Most of us will probably not have an appetite. But what we normally recommend in those situations is that possibly if you can start by taking soft foods such as soups and graduate slowly to solids that tend to give your body a fighting chance and boost your immunity as well in terms of recovery. Now, one of the most interesting studies that came out now from New York was with regards to how we should actually be lying down when you have COVID-19 and how to actually improve your breathing. Many of us would prefer to really just lie on the side or lie on the back, but we've found now that if you are to lie on your belly, it actually improves the way your gaseous exchange occur in the lungs, and it improves circulation in the lungs as well. But it also improves the way your secretion come out through your lungs as well, and allow you to be able to breathe better, and hence you're able to get much quicker recovery and when that happens. But one of the most important aspects, and this is something that we're probably going to be dealing with for a long time, is that because of COVID-19, a number of people are quite affected emotionally, and it sort of brings an element of depression as well. And it becomes quite important, especially when you are infected with COVID-19, to look after your mental state. Because we often underestimate the link between your mental state and your physical state, because there is a quite significant link there. When you are depressed or you are feeling emotionally unwell, it tends to affect the way your body responds to illnesses. So what we therefore encourage is that, human beings are social human beings. Make a phone call to a friend, or you can even do video chats these days. We are able to do that, but keep engaged with other people. Watch a comedy show if you can. Stay away from news at that time. In order for you to be able to take care of yourself emotionally. But again, like you said, Desiree, there are myths that are there, and we've seen them continuing for a very long period of time. You would know that many of us as Africans, we grew up being treated with steaming. Once you have a blocked nose or you have a flu, we were steamed, and you generally feel better. And that's simply because steaming has got that effect on sinuses. So if you steam, your nose is going to get opened, and you'll probably be able to breathe better at that time. But this does not have any significant effect on COVID-19. Patients who steam while they have COVID-19, it does not necessarily improve their recovery time, or does not actually make them any better than a patient who does not have COVID-19. But we have had some concerns with steaming in itself, in that one, the chemicals that are being used, there are certain oils that are being used. We have got no evidence that indicates what those chemicals do in the lungs eventually. Some may get stuck in the lungs for a long period of time and actually give the body that extra need to fight off other things on top of the COVID-19. But also one of the common things that we're also noticing is that people who are steaming as well also present with water burns, because when you're steaming, you basically cover your whole body and your whole face, and you are now sitting in a dark place with hot boiling water, and it actually results in other accidents that actually occur when you're actually steaming. So it does have those concerns. So when you look at the risk versus benefits, it's something that we tend to discourage, and it's a myth to believe that it actually makes a difference in terms of treating COVID-19. But you would also see that people because we say that vitamin C actually assists in terms of building your immune system against viral infections, and this is a fact. When you've got a flu and you're high on vitamin C, your immune system tends to be a bit stronger. We've seen people now consuming a lot of lemons and the lemon juice on a daily basis. It becomes sort of like an overdose. And what eventually happens is that those patients tend to now develop a reflux, which is sort of like a heartburn, which again adds on to the COVID-19 symptoms that they already have and make them even more sicker. So those are some of the myths that are there. Certain people believe that when you are now going to test, it makes you even more sicker. However, we are encouraging people to test, because not only by knowing your results, you're protecting others, but you also get to know how to look after yourself as well.
So we're talking about prevention of infection, but also mild to no symptoms. As you're home, going through all these motions, rest, a good balance of rest and being active, looking after your nutrition and your mental health, at what point do you realize I need to consult now?
Yeah, so there are red flags that one needs to look out for, and this is quite important, because what we've noticed, Desiree, is that certain patients tend to be very well, especially from diagnosis up until day 7, and sometimes even between day 7 and day 10. Usually it's a critical time. So we'll diagnose you probably when you start developing mild symptoms at about day 2, day 3, or even day 5, and then you're generally feeling fine when you're taking medication. And you by day 7 people start deteriorating and start getting worse. So one of the key things that one needs to look out for is, one, you need to, if you start having difficulty breathing, so if you're now having to grasp for air more frequently than you were before, it means that your symptoms are probably getting worse. You need to go back and see a doctor. One of the key things that I always say to my patients is that if you find that you're unable to say a full sentence without struggling to breathe, or without having to stop while you're saying a full sentence, is an indicator that your lung capacity is now starting to struggle. Therefore, it's important for you to go and see a doctor. But also, one of the other things that would happen as well is that, and this is not common with everyone, but you will find that their temperature or the fever starts also just remains high for long periods of time. So if your fever, your temperature is high for more than 24 hours to 48 hours, and this is something that has actually been getting worse over time, then you have to definitely go and see a doctor again. But also, if you find that your mental state is not, your conscious levels is decreasing, so you're not You're not hyper alert anymore. You're not able to think rationally and clearly anymore. And you're feeling confused and you're not remembering things anymore. It means, again, your body is now starting to struggle. And that is a big red flag for one to be able to now have to go to see a doctor. If one is able to get hold of one of those pulse oximetries that you can be able to put on your finger, it also is an objective way of being able to know whether your oxygen saturations are low. However, that is not accessible to everybody, and at this stage, it's also quite difficult to get hold of. But by also just monitoring the way you're breathing, that is often adequate, and it also assists as well.
Let's just go back to something you mentioned earlier in the conversation, research that has recently come out about how to allow yourself to breathe when you're suffering the breathing attacks. Of course, one assumes these are people who are already in hospital or who need hospitalization. What is this research saying about this technique of sleeping on your belly and how this can substitute ventilators? Is it one or the other, or does one assist the other?
Absolutely not, Desiree. It does not necessarily replace the ventilator, but it does help in ensuring that your breathing is much better. The oxygen levels that is able to be delivered into your lungs is much more than it would if you're lying on your back. So again, this is for people who are not in hospital. These are people who are having mild symptoms, who are starting to have difficulty breathing at home. Because remember, what happens is that when you've got COVID-19, the biggest problem is that your lungs are not able to accept oxygen and is to transfer it now to your blood system. Now, for us to be able to increase that capacity, if you lie on your belly, the gaseous exchange is much better, and therefore you feel better. Then you don't get to deteriorate as quickly as you would have if you didn't lie in that position. But also, they also found that the amount of secretions, because the other problem is that with COVID-19 patients, there's a lot of secretions that accumulate in the lungs. And when they accumulate in the lungs, again, air is not able to be transmitted nicely from the lungs into your body. And what eventually happens is that the person have difficulty breathing and end up in hospital because of that. Now, when you're lying prone, the secretions are better excreted, and they come out better and allow for gaseous exchange to be able to occur. And also blood supply to the lungs has been found to be much better. So when they did this research, they found that patients who were lying prone in hospital were able to improve much quicker than those patients that did not lie prone when in hospital. But also one of the other things that one is to remember as well, Desiree, is that when you are caring for this condition at home, it is important that you eliminate smoking, because again, smoking tends to decrease the amount of oxygen that your lungs can be able to take, and that also includes alcohol as well.
Okay, so the last time we spoke to you, you were decrying the government's level of involving independent practitioners in their fight against COVID-19. Do you still feel the same? What are your thoughts about the assertion that Limpopo is leading other provinces in its vaccination process and its ability to get to its citizens, urban and rural?
The Department of Health definitely has been doing a great job in terms of delivering vaccinations. We have seen very good progress in terms of the over 60-year-old patients who were vaccinated. The majority of them who wanted to be vaccinated were actually vaccinated, and we're also seeing the same thing now with the teachers, where most of the teachers that we're engaging with now are actually vaccinated. So it's quite impressive, and we're quite happy with the way it is happening, and we're hoping that this momentum can be achieved now when we are moving that up to between the 18 and 59 years old.
How are doctors and your organization engaging with the system that government has put together of first allowing healthcare workers and then senior people and then teachers for vaccination? We had a commentary the other day of somebody saying it's unfortunate that they're not considering people with mental disabilities who it's difficult to convince to to go along with the protocols that are given of washing your hands and social distancing, and that those might need a vaccine more urgently than people who are mentally conscious. How are you engaging with this process? Do you think the government is doing it correctly?
Well, from what we've seen up to so far, the government has been, in fact, this is what has been different from other provinces. What we've seen is that the government has actually been deploying community workers who are now going into different communities and actually helping individuals in those communities, and I think that is why we have seen so much success in terms of people being vaccinated, and this would include people who are mentally disadvantaged. But I think what I can say, Desiree, is that we are, as our organization, we are watching very closely to see that and ensure that everybody in the province is vaccinated and they do receive this vaccine as quickly as possible. Because as we discussed last time, it is important that we run faster than the virus itself and ensure that people are actually vaccinated. But also, I think it is important, Desiree, to mention that there's a percentage of people that when they get vaccinated, they are likely to experience some symptoms. Symptoms such as headaches and also feeling a bit tired. They might also develop some flu-like symptoms as well. This does not necessarily mean that they have contracted COVID-19. It generally means that their body is now developing an immune system that is going to help them to fight COVID-19. And generally, these symptoms tend to last between the first day and probably up to day 5. And after that, they feel better and they can still go back and get their second dose as well.
And just a quick one, have you vaccinated? How did you find it?
I vaccinated. In fact, I was one of the first people to vaccinate. I got the Johnson & Johnson. I did not experience any symptoms even up until now. And I'm doing quite well. I'm quite happy I did.
Very important conversation. Thank you so much for your contributions this morning.
Thank you. Enjoy your day.
Dr. Mabowa Makhomisane is the president of the Limpopo chapter of the Independent Practitioners Association, and just having a conversation with us about myths and on home remedies and what to do at home as the whole nation tries to battle this pandemic. Let's take a break.